So here at Bella Glow Med Spa, we offer microneedling, and we use the Skinstylus, this big gold pen, and you can hook onto it 11 pin, 12 pin, 36 pin, whatever you're trying to target. And then here you can adjust it. So typically I'll just start on 0.5 millimeter for the depth when I'm doing the forehead, just because it's a bony prominence. So wherever it's bony, you don't need to go that deep. And this pen will actually all the way go up to 2.5. I've honestly only used it up to maybe about like a 1.75. If you want to break up like acne scars or like bigger scars, you can turn it up a little higher. So typically, what is microneedling and what are we trying to target? So microneedling is AKA collagen induction therapy. It's going to help stimulate collagen in the skin. It creates like little injuries in the skin, which then helps stimulate collagen production. I typically like to have my patients do microneedling quarterly, and I'll also pair it with PRP. PRP is platelet-rich plasma, so I'll take the blood out of the arm, spin it in the centrifuge, extract that liquid gold out. I'll smear that liquid gold all over their face, microneedle it, inject the PRP into their face, and they'll get really nice collagen induction therapy. And also they'll heal a little bit faster as opposed to if you're not using the PRP. So anyways, with PRP and microneedling, you could do it quarterly because then you're going to constantly stimulate collagen production. I'll have my patients do it like every 3 to 4 months, and they love it. Their skin's glowing, youthful, tight. It helps with pigment, it helps with tightening, it helps with fine lines and wrinkles, and they just love it. It's great in combination therapy with everything else we offer here. And I'm gonna start on a 0.5. So I've been numbing with topical lidocaine for maybe, I don't know, 25 minutes. I could have done it a little bit longer if I wanted to. And this is hyaluronic acid. So I clean my whole face, make sure it's sterile, and then I just applied a little bit of hyaluronic acid, and I set my pen to 0.5. And yeah, I'm gonna microneedle it, hopefully get some nice collagen induction therapy going on. And we'll talk more about what microneedling does, the benefits, who's a candidate, who's not a candidate, the aftercare, the pre-care. We'll talk all about that after I'm done. So the end point is mild erythema. A little bit of pinpoint bleeding is okay. Sometimes patients bleed a lot because maybe they're on like a blood thinner or something too. It doesn't scare me. Typically though, you want to be careful on skin types 4 and above. So like me, I'm a skin type 4. I'm going to be very prone to hyperpigmentation. If your skin types 1 through 3, I'll typically go a little bit harder on those patients because they're going to be less prone. Okay, I'm gonna turn it up a little bit. We'll turn it up to a 1, just because we're on this meaty part of my face. Ow. I am a big wimp, I will be honest. I probably do this once or twice a year. But of course I tell my patients to do it quarterly. I went up a little bit just because this is like thicker tissue in here and I can go a little bit deeper, and I'm also targeting a little bit of acne scarring. Owie! But it hurts right now because I didn't numb long enough, but it's okay. I should have numbed for maybe like 45 minutes. Okay, so when someone comes in, we're gonna give them topical benzocaine, tetracaine, lidocaine. It's like a topical lidocaine for your face, and it's gonna help with pain. It's gonna numb you. So if someone comes in, we usually have them come in like 30 to 45 minutes early so they can brew in this numbing to help decrease pain. And if you sit it long enough, you won't feel anything, you know, but I didn't sit it that long right now. So I took my depth back down to 0.5 millimeter depth because there's no need to go too deep. I mean, this is just the forehead. It's a bony area, you know? Ooh, it hurts. I don't like this part, actually. I gotta go down. Gotta go down. Better. So after you get the treatment done, you just feel kind of a little bit like tingly-ish, also because the numbing is wearing off. And then I also just feel like really tight, like my skin's starting to feel really tight, and I really like that feeling. Something you want to be careful with microneedling is you want to make sure you skin type your patient accordingly. So a skin type 1 is going to be somebody that is very pale, maybe like of Swedish descent, very light skin, as opposed to somebody that's a skin type 5. 4 or 5 is going to be someone with like Asian or Indian descent in them. So if you're a skin type 1 through 3, you can get a really good thorough treatment with this. You don't have to be too cautious just because of your low risk of hyperpigmentation. If you're a skin type 4 and above, like me, I'm half Asian, I'm gonna hyperpigment. I did a peel not too long ago, and I just hyperpigmented right there, so I didn't even go over that little spot on my face, because this will take like a whole year to go away, just because of that Asian skin tone. Prep for microneedling, I usually tell my patients to avoid any blood thinners, just so they don't bleed too much. And then I'll usually have them like take vitamin C to help with healing and everything. But typically they want to stay out of the sun too. So that's a big thing. Always make sure your patients are staying out of the sun at least 2 to 3 weeks prior to getting treated. Once they get the treatment done, I usually send them home with like the blood on their face and everything. And then they can do like a gentle cleanse. We love Elastin skincare. We carry the little kits here. We also carry Factor 5, which has stem cells. Those are gonna really help with healing if you didn't do PRP with the microneedling. And yeah, you just do like a gentle cleanse, hyaluronic acid, stem cells, sunscreen. Those are gonna be your best friends for the next 2 weeks. I recommend avoiding, like exfoliants, harsh cleansers, anything that's gonna sting and burn, you should not use for those 2 to 3 weeks. Wear a big hat, wear sunscreen, cover everything up. Especially if you're a skin type 4, because if you go out in the sun with a controlled abrasion on your face like this, you're gonna hyperpigment. We like Elta MD sunscreen. That's the best sunscreen that you can use here. It's like a medical grade sunscreen. And then you wanna keep it clean, right? You don't wanna get any dander or anything in it. So typically I'll tell my patients to change their bedding, change their sheets, change their pillowcases, because you don't wanna lay your head on anything that's gonna infect it. You also want to be careful with exercising. One time I microneedled my neck and I exercised like 2 days later and I started sweating and I got like folliculitis and it was horrible. I recommend taking a break from all that stuff that's going to make you sweat and open up your pores, okay? And then it takes about, I don't know, maybe like 10 days to like fully heal. But I usually notice the next day that you're just like a little bit red, like a sunburn. It's nothing crazy, but you're not healed. So you just want to be careful and follow all those instructions so that you can maximize your result.